slow up, no I don't take shit. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up. I don't ever slow up, no I don't take shit. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up and make a statement. I don't ever slow up, no I don't take shit. I got no love for the fakeness. If you wanna play tough.
We're back here live, the Let's Get Comfy podcast. Without further ado, we bring a legend to the stage here. And I want to just say, man, his team, the Spectrum Medical Partners, they have been across here. About 17 of them have stopped by and said, Norman, you better not mess up with our chief medical officer. And I assured them that I will not. I have the amazing,
thank you,
well esteemed, I might title this segment called From Bogota to Baltimore.
That's correct. Yes.
To Baltimore. Dr. Andres Vallejo, man, thank you so much for joining. Round of applause.
Thank you.
So happy to have you join the platform today, man. And in Let's Get Comfy fashion, I always allow the guests to introduce themselves, and I always ask healthcare professionals, brag on yourself a little bit.
Well, thank you for having me. Yes, I'm Dr. Vallejo. If we go a little bit beyond those titles that you just mentioned, right? CMO, Chief Quality, have now had the Chief Quality as well for the company.
Okay.
Physician, Medical Director, Post-Acute Care Enthusiast, basically.
There you go.
Overall. But if we move past those titles, it's father, husband, brother, and then again, someone that developed a passion for long-term care. And that's what I do right now. I'm all about post-acute. I'm all about long-term care. I'm all about caring for those patients, those vulnerable patients that we have in our skilled nursing facilities. How do we take post-acute care to the level where it should be?
Yes, sir.
That's the question I ask myself every day when I wake up and go to a nursing home. How do we elevate the care that we're providing for those patients? As you know, critically complex patients that we get. Nursing homes, post-acute care is developing and evolving so quickly, right? It's not the same it was 5, 10, 15 years ago.
No.
It's completely different now, the complexity itself. So that's in general who I am.
Yes, I love that. All right, so you've practiced across the hospitals in different countries, landing in the post-acute space now. What have shaped you in how you lead Spectrum Medical Partners today?
The way I lead is by, first of all, example, right?
Mm-hmm.
You can't lead if you're not providing example that you need for your team, right? And also making sure you take the time to build your team as well, right?
Mm-hmm.
You need a team building mentality, right? You need to develop the persons that work with you, your nurse practitioners, your physicians, your nurses, going specifically to post-acute and skilled nursing facilities, right? So build your team starting from your CNAs, nurses, unit managers, director of nursing, administrators, and then comes, of course, a team that work alongside with you, your nurse practitioners and your physicians. Take the time to develop them in terms of quality, provide them with the tools for them to be successful in the post-acute care setting. There's a lot that goes into what it's required to be successful in the post-acute care, right? Mm-hmm. That's probably for another question, but in general, how I lead is that with that mentality. Build your team, know your team, and lead by example.
Lead by example. Mm-hmm. I love that.
Thank you.
I love that. Leading by example, it just shows that you're a person that's willing to get in there, willing to work hard. And I could just tell you just from the impression of every single person that I spoke to at Spectrum Medical Partners, everyone says, I love Dr. Vallejo. That's before I even spoke with you or met you at all.
You can't ask other people to do things you haven't been doing by yourself.
Yes, sir.
I mean, that's not possible. Right, that's
yes,
not possible. Yeah.
All right, so getting into quality, clinical quality, of course, that's always a focal point. And I know that's what has to be a mission of Spectrum Medical Partners as well. With rehospitalization is always a metric in every skilled nursing facility.
Yes.
What's one single myth you'd say about why patients bounce back to the hospital and what that actually drives them back to the hospital, right?
There are a lot.
It's a lot.
There are a lot of myths out
Okay,
there
let's share 'em.
when it comes to skilled nursing facility. I can tell you one of them. It's about patients get discharged from the hospital. They go to a nursing home. They come back to the hospital because they were not given the proper care at a nursing home, or they missed the medication. It's a nursing home fault. But at the end, really, what it really drives those return to hospitals are actually fragmented transitions, right?
Whoa.
We already know the kind of patients that we're getting in the nursing homes. We already know how complex they are. We already know that complexity is moving towards a nursing home, right? From the hospital to the nursing home. So we need to understand that, being able to provide those transitions, being efficient in those transitions of care from the hospital to nursing home, home, or whatever the next transition would be, if we manage those transitions effectively, that's going to be probably the biggest driver to reduce return to hospitals. Yes, we have tons more, but I think that's going to be one of the main ones that we see now. At Spectrum, of course, we have learned that one of the ways, right, to also decrease that return to hospital is by embracing that patient early on admission. The right team at the right moment, immediately on admission to the nursing home. Embrace that patient that is coming to your facility. Make sure you're seeing that patient in the first 24, 48 hours. Make sure you're communicating with your teams in the facility. And that's a good way to start for that patient. Yes.
What does a community benefit from with aligning and partnering with Spectrum Medical Partners?
Well, the benefits they get is the integration.
Okay.
Patients get discharged from the hospital, most of the times medically optimized. Always, not always. Sometimes we get really complex patients that were literally in the ICU just 24 hours ago.
Right.
So they leave most of the times, yes, medically optimized, but they don't get discharged medically integrated from the hospital. They get discharged.
That's the first time I heard it put like that, man.
Yes. So,
that's good.
So they get discharged. Not always. We don't have, who's going to be seeing that patient next?
Yep.
Do we have a PCP on file for that patient? Are we making sure that discharge summary is accurate? Are we making sure that medication reconciliation is completed? Follow-up appointments that are directly related to the reason those patients are going to the nursing home, right? Whether it's a surgical appointment, follow-up after a fracture, anything like that, right? So we're making sure that integration is happening, that the team that is going to be caring for those patients in the nursing homes, in this case, us as Spectrum, that we understand the importance of that integration of care and coordination of care.
Yes, sir. So technology, AI, that's always that's a hot topic right now, a trending topic. Do you guys have anything that you guys have integrated with Spectrum Medical Partners that will help with some of those healthcare complexities?
Yes. So our EMR that we use in the company is called Arista. It provides a lot of features for us. When it comes to technology, it's not, for me, at least for me, it's not about what's the latest flashy, complex software, hardware out there that we can come in and use, right? It's about how practical that is, right? How can it actually use that on the ground, on the patients, real time, real data, right? If we have real data on time and practical, those things together, I don't care what the technology is. If we shorten the amount of time it takes when a patient has a change in condition to the time a clinician makes a decision for that patient, if that technology shortens that time, I'll take it. I don't care what is it, software, hardware, I'll take that. So I think that's what we need.
I like that. You sound like you back to the basic with it.
It should be back to the basics.
Yes,
it should not be complex.
No.
It's already a very complex industry. There's already a lot of regulations. So we don't need more complexity. We need simplicity. And patient care, especially this population, elderly patients, they need simplification of care.
Right.
That's one of the main goals that actually coming all the way up from the Post-Acute and Long-Term Care Society, right? These are elderly patients, geriatric patients. The last thing they need is complexity. We need simplicity. We need to simplify medications. We need to simplify medication lists that the patients are coming from, that simplify their life. It has to do with quality. It has to do with dignity as well for the patient when it comes all together. Yeah.
Yes, sir. All about quality care, timely and effective care. I can hear that in you.
Time to intervention, TTI. Time to intervention.
Oh,
That's
man.
critical. Yes.
Yes. I said that again.
TTI. Time to intervention.
I love that,
Yes.
man. We might have to steal that one.
Yes.
Hey, you need to patent that, man. I like that. I like that.
Yeah.
You need to get shirts made with that.
Yeah.
Honestly, Spectrum Medical, I gave you that idea, man. That's a really good one.
Thank
All
you.
right, so future projects. So let's talk about future growth plans. What are some things you guys are working on now? You don't have to give too many secrets, but
We are expanding, of course. We are right now at probably around 49 counties in Florida.
49, wow.
So we're basically statewide. Statewide.
Statewide.
Under the umbrella spectrum, we have almost 18 different companies. Podiatry, wound care, psychiatry, psychology. So we have the whole spectrum of care to provide to our patients.
Yes, sir.
So expanding, growing, those two are one of my favorite two words. Expansion and growing.
I love that.
At the same time, be able to standardize the care that we provide for those patients that we've seen.
I love it. I love it. So final question for you. If you could change one thing in healthcare tomorrow, aside from the budget, aside from politics, put that to the side, what would it be and why?
It will be the educational part of it. Training our physicians to understand elderly population. It should not be something that is exclusively for geriatric residency. Patient that medical students call internal medicine residents, family physicians, general practitioners. Geriatric should not be a subspecialty only. Say for those that want to pursue that career, it should be a mandatory thing for everyone because everyone will be involved with elderly patients, geriatric populations. So I think having a great investment in that part of it, a piece of education and understanding that our residents need more education in that part, it will be great.
I wasn't expecting that one. That's a good one. I never looked at it that way, that educational piece doesn't happen. But if we all stay alive, one thing we're going to do is age, for sure.
Yes, definitely.
That's a good answer, man.
Yes.
Any final thoughts you want to share and ways to connect with Spectrum Medical Partners for communities that are looking for a better quality?
Well, our team is out there, right?
Yes,
depends on the market or which part of the state you are. But I guess the best part, go to our website, smpmedical.com, right? All the information is there. Our business development team is there, care coordinator, physicians, CMO, myself, of course. Everyone has my number. Everyone has my email. So anything needed, of course, we're all here.
Yes, sir.
Yep.
Well, thank you so much, Dr. Vallejo.
Thank you, Norma, for
if
having
you're
me, of
looking
course.
for a great continuum of care under one umbrella, Spectrum Medical Partners. Dr. Vallejo, thank you so
very
much, sir.
Thank you.
All right. Appreciate it, man.
Norman. All right.
Thank you so much. I'm so glad you stayed with us here. The stage is set for the dynamic duo, the gals from KG Health Podiatry. Thank you so much for joining. I have Jennifer Scahill with me and Rana Tadros. I did it?
You did it.
I did it, yes. I did it. Rana Tadros, thank you so much for joining us today. Both are account managers with KG Health Podiatry. As normal, please introduce yourself and feel free to brag, all right? Yeah.
Norman, thank you so much for having us.
Welcome.
I'm Jennifer Scahill with KG Health Podiatry, one of the largest and oldest podiatry companies here in the state of Florida. We've been here for over 26 years and servicing facilities in South Carolina for a little over 4.
Oh, awesome. Ms. Rana?
Hi, my name is Rana. I'm one of the account managers with KG Health Podiatry. I've been with the company for almost a year, and I love servicing residents and making sure they receive the best quality care.
Absolutely.
Oh, wow. You guys had great intros, too. Short and sweet. Short and sweet. So we're going to stay on the lighter end. As I always say, this is Florida's #1 healthcare advocacy edutainment station. So, Ms. Rana, I'm going to start with you. We're going to talk music. I love music, so I always ask this question. What's your favorite genre of music?
I love R&B and hip-hop.
Okay.
Love
R&B.
me some Drake.
Some Drake?
Yeah, his new album was great. But the song that would fit my work ethic
Okay.
would be Stronger by Kanye West. I think that every day as an account manager it's a challenge, but it's also a challenge to be better, to show up, and to make sure that the residents have the best care that they can have, and something that we can do for them.
So you deep, you connected a song to your work ethic, automatic.
That's
wow.
when I liked Kanye West, though.
Yeah.
I used to love him.
Oh man, well that's good, Rana. So sticking with you, Rana, tell me about life as an account manager with KG Health Podiatry, and how you integrate with facilities throughout the state of Florida, and what does a partnership look like with KG Health?
So we service skilled nursing facilities, ALFs and ILFs, so assisted living and independent living facilities, and we provide mobile podiatry care. So as an account manager, we ensure that we can get them contracted, we make sure they're scheduled to be seen on time, make sure that residents have their appointments coming up if they need it, or if there's any barrier between the facility and KG, we make sure we cover that gap.
Gotcha. Okay. That's a very needed service. But I want to ask, and I'll shift this question to Jennifer. When people think about foot health, right, they may not think of it as a life or death situation. But if with us, we work in the skilled nursing industry, so we have the opportunity to see, different feats there, right, in the communities. How does foot health, right, podiatry services connect with clinical outcomes and improving clinical outcomes, even from hospital readmission rates? How does that connect?
That's a great question. So many people think of podiatry and think of foot comfort, when in all actuality, podiatry, especially with our seniors, it's more so about preventative care, being able to prevent, ingrown toenails or calluses that are uncomfortable, or even pressure ulcers. When we're able to prevent those things, that also helps the patients to, have a better quality. They're able to walk a little better, less fall risk. And things of that sort. So it definitely prevents admission into the hospital when we're able to allow this preventative care to happen on a routine, consistent basis.
That's good. That's good. So, Rana, I ask you this question: like, as far as you guys providing services, a mobile podiatry, what advantages do you see that as being for a lot of patients in the communities that you serve, where they kind of don't have to have that struggle of having their patient go out of the facility for the care?
So I think for us, it's important to make sure that the resident is comfortable. Comfort is huge, and by our podiatrists going on site to see them, that gives them also like a familiar face. They've seen these people before. They're not seeing a different podiatrist every time. And they're also, a lot of these residents do have, mental, they don't remember certain things, just different issues, and with just us being able to comfort them in their own place where they stay. I think that facilities sometimes don't realize we're not just a vendor, we're just an extended part of their team.
Absolutely.
Gotcha. So this is a question that just popped up in my head right now, okay? But I want either of you to respond to this. Like with podiatry treatment, a lot of times, I'm a male, I don't go, get my pedicures like I should, right? But if you think about in the skilled nurse and the clients that we serve, they don't have the opportunity to go to the nail salon, right, for that type of foot care, right? If you guys could, what comment would you say to families out there in regards to having their loved ones and just having that overall comfort feeling? Like, what would be your answer, your response to that? Because I know when I go get my pedicure, it feels so much better. I feel like I lost like 5 pounds or something. You know what I mean?
Well, and it definitely does allow a level of comfort for the residents, because their nails are trimmed, the calluses are trimmed. There is a comfort level to our podiatry care as well, in addition to the preventative aspect. So I would say most definitely allow your loved one to receive the podiatry care, promote it for their comfort and for their well-being.
Gotcha. Thank you for that. When you're out marketing, right, you guys are both account managers. What's some of the barriers you guys see, right, out in the industry? If you tell me the barriers.
Communication.
Communication? Can you expound on that? What are some barriers of communication?
They do a lot. DONs, administrators, it's a hard job. And communicating with, vendors that want to make sure that these residents have the quality care that they need, it's hard because sometimes a resident gets missed, or, a schedule doesn't, come the way, or not everybody's seen like they want them to be seen. So Jennifer and I try to make sure that we could be that person in between them to make sure that, we do the hard job so the residents can be happy, and then there is no extra job for the administrator or DO1 to do it for us.
Yes.
We are that person.
And if I could add to that, because that was
Yes.
such a great point. The facility staff members they're wearing so many hats.
Yes.
They're doing a lot. There's a lot of residents that they're caring for on a consistent basis. And for us to come in as their, preferred podiatrist, we're able to handle all of the scheduling aspect of things. We're able to communicate with the staff members that they deem appropriate, and we're able to communicate with them and let them know who's scheduled to be seen. We've already got the room numbers and all that good stuff squared away, so we can go right to the resident's room, and it really does remove some of the burden from the facility staff member, and we want to do that as well as caring for their residents. And we want to care for the staff too.
That's good. Yeah, I like that. So that being stated, new contract, new partnership with KG. What does that look like? What does the first 30 days of onboarding and getting established as a new partnership, what does that look like with KG Health Podiatry?
The first 30 days is really a lot of us getting to know one another.
Okay.
Is sharing with the facility what they can expect of us, asking them what they need of us, and then making sure that we can deliver what it is that they're expecting of us and what they need to be able, so the first 30 days is really about, introducing one another, getting acclimated, and then, scheduling that initial visit date so that we can get in there.
Making sure we have the appropriate, people that want to be in touch with us, because once the administrator kind of signs the contract, he isn't, he's like, this is for social services or this is for the director of nursing. So just definitely making sure that we have the right people to reach out to get this first scheduled.
Now, so let's talk a little personal. What is the aspect facilities get with working with, specifically you all, right? Talk about yourselves once again.
What do they get? I'm sorry.
What do they get specifically with working with you all? What's the good, give me one good thing about working with Rana.
Well, when we onboard the new facilities and they get to meet us, we do love to bring goodies. We love our sweet treats.
Yeah.
And we make it a point that we are always reachable. I am always reachable. My cell phone is always on me, whether it's a Saturday or a Sunday. If I don't want to do it, I still do it. I want them happy. But it's also, what I like to do.
Good.
So
I like that.
I brag about them working with me because they'll always get an answer back or a text back.
Absolutely.
Even if I'm on the beach.
The care that they're providing to the residents doesn't stop at 5 p.m. or on the weekends. And so we always present ourselves as being available to anything that they may need. And even if we're not the right person to address whatever question they have, we're able to direct them appropriately.
Yes. So talk about, you said about reaching you guys. What's the best way for vendors out there, new partnerships in the skilled nursing, ALF space, ILF space, to connect with you all?
We're really open to whatever form of communication is best for the facility staff members, whether that be by phone call, by text, by email, by chat, whatever their preferences are. And we make ourselves available in each of those avenues.
And we also make sure to visit all of them too. So if somebody wants an in-person meeting, we do set that up as well to
That's awesome.
be present.
Awesome. So we're going to close out with another joke, another game here. I like to always ask this question, right? And so it's for you, Miss Jennifer. If you were faced with a bear in the woods, you out camping, right? What would you do? Would you run, die, or fight for your life?
Well, first, nobody would believe this story because I don't camp. However, going along with the scenario, I think I would like to think that I'd remain calm, but realistically, I would probably freeze up for a few seconds and then think about it and try to negotiate with the bear, because I've got deadlines this week and I need for him to revisit this on another day in the near future when he's in a better mood.
Gotcha. So you're going to sit there and try to talk it out with the bear.
Yes.
Wow. Okay. So that's that account manager, say she thinks she can wiggle herself out of anything, huh?
I'm trying to negotiate. Yes.
Yeah. What about you, Ms. Rana?
I told her I would run, but then when we were having that conversation, she was like, they're going to think you're praying. They're going to kill you. I'm like, well, I'm running.
Well, I'm negotiating, so you run. And I'll handle
You can stand there negotiating.
Golly. Wow. So that means
we truly work as a team.
That's how we actually work. She negotiates and she stands and I'm just.
Well, I tell you what it sounds like to me though, that Rana's still going to be alive, be able to tell the story, because they going, and then you going to be,
I don't know if I'd be alive, Norman. He's probably the bear's probably way faster than I am.
Yeah,
I
way
can
faster
run, but
than
I don't
you.
know if I can run that fast, especially if I'm hungry.
Oh. Yeah, so any final thoughts you ladies would like to leave with the audience here today? I really enjoyed this conversation with y'all for
Yeah,
sure.
for sure,
Yeah,
for sure.
any final thoughts?
Just the importance of podiatry care, and not even necessarily for, seniors, but even, of our age, just making sure that we really do take care of our lower extremities, because one day, we are going to be older, and it's
Right.
going to count in a way that we don't necessarily think of now.
You're
So
right.
again, the preventative care.
Right. Yes.
All preventative care, and I just want to say thank you, Norman. You are awesome. Thank you for
so
having
much.
us.
I really
We
appreciate it. It's been an honor to have you all.
For
the
sure.
energy as well. And I told you, Rana, you was gonna do good, didn't I? Yeah. Well, we're wrapping it up with the dynamic duo, the KG Health Podiatry Gals. Hope you enjoyed this segment of our Florida Healthcare Association Conference and Trade Show live series right here with the Let's Get Comfy podcast.
Thank you,
Yes.
Norman.
Up next, I have someone I'm excited for you to hear from, and I know I should say, you will enjoy this conversation. All right? She is with SimplyThick as a regional sales director, a dysphagia implementation specialist, healthcare educator, and advocate for improving patient safety across the continuum of care. Her days helping healthcare teams solve one of the most overlooked challenges in healthcare: what happens after a swallowing recommendation is made. I welcome to the Let's Get Comfy podcast, the Michelle Baker from SimplyThick. Thank you so much for joining us.
Thank you. Hey, Norman. I'm so happy to be here.
Right.
This is such a great thing you're doing. I
I
love
appreciate it. I appreciate it. Thank you so much. You like that introduction?
I did. That was awesome.
Yeah.
I feel like it's far better than I deserve, sir.
Yes, yes. So if someone check you out on LinkedIn, they're going to notice that you were recognized nationally as one of the national sales leaders, right, in sales. So that's one thing stuck out to me. And with you working with SimplyThick now, I wanted to ask if you could share with the audience out there, what's one secret, what's one sales secret you could share? And I work in business development too, so I'm going to steal it from you, by the way.
I hear ya.
Yeah.
Oh, my gosh. I think that a lot of people think, Norman, that the best salespeople have like the perfect sales pitch, right? I think a little bit differently, because when I go into a long-term care building, I'm not going in thinking about, okay, why is my product better than the competition's, and focusing on just trying to get an audience with the customer about a features and benefits presentation. When I go into a long-term care building, I'm asking a lot of questions. I'm like a little private investigator, sort of. My goal is to ask questions to help the customer realize or if there's any problems they're having that they may consider or think that it's normal to have.
Right.
I'm asking questions to staff around, where are they frustrated? And I spend a lot of time asking questions about, particularly with SimplyThick, is their dysphagia management care program. So I'm asking staff, where are some of the areas that you're frustrated? Kind of asking questions around and looking for inconsistencies. Where is the highest risk for patient safety risk? And, SimplyThick just naturally ends up becoming a solution for a lot of those really meaningful issues. Yes. And so I go in trying to be a consultant and just really asking a lot of questions and doing a lot of listening. Because I'm still a firm believer, people don't buy products. I think people buy solutions to really meaningful problems.
Yes. Well, I like how you stated that too. All right. So tell us about SimplyThick. What's the mission of your organization?
So SimplyThick's mission, of course, is we're very, very passionate about dysphagia care management. So with the SimplyThick thickener, it is unlike any other thickener on the market. It's the only hydrolyzed or gel thickener on the market. So we're the most passionate about education, helping educate healthcare communities around safe thickening practices, making modified texture diets appropriately, not only for patient safety, but we want to help them understand why it's important that the food, the modified texture looks beautiful on a plate, and patient dignity. So Our mission, we're passionate about education surrounding especially the IDDSI, the International Dysphagia Diet Standardization Initiative. So we spend a lot of time educating around that. So basically education, working with healthcare communities to implement just really safe dysphagia management care practices.
It's good, yes. So I will say, with SimplyThick, thickeners, dysphagia, it's something that's not a focal point a lot of times in the clinical outcomes until there's an issue, right? Tell me about the communication from a time where a patient is actually admitted to the facility and some of those protocols where how you guys integrate your services with a patient that maybe that have some dysphagia, sorry.
Yeah, so that's a really loaded question. There's a lot of different ways that we can help. You know, with dysphagia management programs, Norman, it's such an interdisciplinary conversation.
Yes.
And that's why even with IDDSI implementation or just a dysphagia management program period, that's where a lot of people miss the boat is healthcare is very fragmented. You know, conversations are very fragmented. So a lot of nursing doesn't always talk to speech, or speech doesn't always communicate well with dietary.
Right.
Or nursing and dietary don't really communicate. But what we take a look at in the entire dysphagia program is we can help with audits on how they're thickening beverages or supplements or even gravies and sauces. And we can help work with dietary and like their workflow process inside the kitchen. You know, a lot of, especially in long-term care, we're supporting a lot in this area because dysphagia management care hasn't always been top of mind. A lot of people put programs in a long time ago. A lot of long-term care buildings have not implemented IDDSI. And so what we do is we take a look at everything that's liquid with the dysphagia patient needs to be controlled and managed. So we really dive deep into what are those thickening protocols? Are they using pre-thickened beverages? Are they testing any of the thickened supplements or thickened liquids? Or are they doing any testing on the modified diet? So we take a look at what their current protocols are, and we see how can we, if they're not testing, they should be testing, and that's really the big reason for IDDSI.
Right.
Because the old National Dysphagia Diet manual did not really have a whole lot of guidelines or clarity on how to make these modified textures or how to thicken beverages. So it led to a lot of guessing. So what we're finding is in the long-term care community, there's not a lot of really strong processes and protocols put in place. So I think SimplyThick and myself, we bring a really interesting skill set to working with these long-term care healthcare communities. We're taking a look at what their processes are or lack thereof. And then, so I'm in all these buildings and everybody has different issues and everybody has different things going on. So with that, I get to see where folks are struggling, where they have some of those gaps in these processes, and we can give some tips and tricks on how they can improve their process. I'd like to say there's a one-size-fits-all, that we have like a blanket program that we can teach everybody. But just like nutrition is not a one-size-fits-all, dysphagia care is oftentimes not implemented as a one-size-fits-all. So we try to streamline that and get more continuity in the protocols, and it's just done in a lot of different ways.
Right. So let me ask you this, and from viewers out there, community members that may not be so abreast to healthcare and a lot of the terminology, I want to ask you, and as you know, in the skilled nursing realm, it's a big focus on when you're going through a survey, right? The aim for survey, which is dignity at mealtime. What's SimplyThick viewpoint on dignity at mealtime, right? What does that look like in you all's eyes when it comes to patients with dysphagia?
Yeah. So patient dignity around dysphagia typically we're seeing the conversation happen more and more. But, you know, when you have a patient that's on dysphagia, consistency is not their preference. Their preference is they want to be able to eat nice meals. They want to be able to eat food that tastes really nice.
Gotcha.
They don't want to be a dysphagia patient.
No.
Eating is such a social part of the aspects of who we are as humans.
100%.
You know, so dysphagia patients.
You see you, boy.
I know. Listen, I love to eat. It's my hobby. Okay. But what I see is dysphagia patients, they don't want to be on dysphagia diets. They don't want to be on thickened liquids. Okay. So we see a lot is when you're talking about dysphagia trays or plates of modified texture foods, it seems like patient dignity hasn't always is thought about, I think, but they haven't really had either the resources or the tools to improve the nutrition on the plate, how it looks on the plate, how does it actually taste. And, dysphagia patients, Norman, they want to be able to eat nice meals, eat good food. They want to celebrate birthdays. They want to go out to eat with their family, right? So what we see and what we try to talk about with a lot of the long-term care food service teams is make sure you're not watering down the nutrition. You really want the meal to mirror what you're giving your normal patient or resident, right? You really should only be focusing on how to modify the consistency of that. So when it comes to patient dignity, we try to talk about that a lot and try to get a lot of the CDMs and a lot of the kitchen staff to think about that, because we want them to have dignity in what they're eating. We don't want them to have to own. The conversation should not be and only be around patient safety.
Right.
It should be more about the dignity of the patient. If a dysphagia patient sits down with the plate, they want to feel dignified and comfortable, and they want to be satisfied with their meal, just like you and I would with their normal meal.
Right.
Yeah.
So as you know as well, and we're talking about a lot right now, focal point in the skilled nursing setting, ALF setting, memory care as well. But what about after discharge? What about at home? Of course, Florida has a focus on aging in place. What's SimplyThick's viewpoint or anything you would like to share educational-wise for viewers out there in regards to dysphagia, or if they're having a family member dealing with that, but they're actually in the home?
Yeah. A safe patient discharge is really interesting to talk about because, as I mentioned before, healthcare is very fragmented.
Right.
A safe patient discharge should really be more than just sending the patient or resident home or to the next caretaker on the correct diet order. It really, a safe discharge really should be is the next caretaker should be provided information regarding what the correct diet is, why they're on that type of diet or on that level of thickened liquids, why it's important, and also resources on how to appropriately prepare that for them in the home.
Yes.
But what we see is the hospitals often assume that the skilled nursing unit's going to educate the family on this. Skilled nursing assumes that home health is going to educate the family on this.
So a patient, that being said, a patient that has dysphagia, they would have to have home health services if they're at the home?
They don't always have to.
They don't have to,
No,
okay.
they don't have to. I mean, gosh, I hope they're getting some sort of resources,
Got it, okay.
because a patient with dysphagia is having swallowing difficulties. So if that's why SimplyThick, we work very hard to touch all those people. We're working with everybody in the hospital that touches that patient upon discharge. We give them, sample kits. So because most of the hospitals in the state of Florida utilize SimplyThick. So it's a really big push when you're really talking about continuum of care, making sure that patient discharges with those sample kits. So whatever care they're getting inside the hospital or inside the skilled nursing unit, when they discharge home, they have access to those same resources.
Gotcha. Okay. So from your perspective, you've been in healthcare, working in healthcare for quite some time now. You have long tenureship. With this, what's the next phase? Let's say the next 12 months. What goal do you have, or what focal point does SimplyThick have in some of the future growth plans?
Yeah. So, I mean, of course, everybody wants to grow, right? But I think SimplyThick's goals over the next year is beyond sales. It's more around, we want to position ourselves as a resource to any healthcare community that is trying to improve or implement a dysphagia program, regardless if that's implementing IDDSI or maybe that's just auditing your current thickening system. Maybe you just need staff education. So we really want to position ourselves as a resource in supporting that and not just a manufacturer. So if in the next year we can honestly say that there are a lot more facilities out there with safer dysphagia management programs, I think we can say that's a pretty successful year.
Oh, I do too. I do too. And for individuals out there, community members that would like to partner with SimplyThick, if you can go over the process, connecting with you all, share your social media pages or website, but also what does it look like, whether there's a contract involved or sort of the onboarding process, if you will.
To become a new customer, is that what you're saying?
Yes.
So first and foremost, I'll tell you to follow John Holohan, our owner of SimplyThick.
Okay.
He has a fantastic page of resources with SimplyThick John. He's on TikTok. He's on YouTube. Oh my gosh, he's on Facebook. He's on everything.
What's his name again?
John Holohan.
Okay.
But you can find him under SimplyThick John. I think that's
SimplyThick
his
John.
social media handle.
All right.
He has great resources for
Big
rest
shout
of-
out to you, Mr.
Yeah,
SimplyThick John.
John is amazing.
Yes, sir.
Such an amazing person. He's such an advocate too there's tons of recipes. And if you're managing dysphagia at home, that's probably I would tell you to search out John before you search out me. But if you need to get a hold of me, I'm on LinkedIn. This is Michelle Baker. We do have a Florida Instagram page, SimplyThick Florida.
Okay.
You can reach us at www.simplythick.com. And you can reach me on LinkedIn, or you can go to our website. If you need to get a hold of me, you can order samples free as well. At SimplyThick, you can also request ITSY training or free education through the ITSY or through SimplyThick's website.
Gotcha. Okay. All right. So they're very accessible, but they also champion the fact of having that media content out there to provide that education in a real authentic way to connect with the community.
Yeah.
I really love that too. So what
You'll
is
love
it?
SimplyThick John. SimplyThick John. He's really incredible.
All right. So, and we know you are going to continue your career, but I did want to have a final message and question to ask you. If you were to walk away from healthcare today, what would be one long-lasting factor or memory you would want to leave with the healthcare industry?
I have been so astonished and humbled by the level of care that we actually have here in the state of Florida, how much people care, how they show up every single day and serve their communities, and they serve their patients and their residents. Even when times are hard. So just the way that people, it's such a beautiful example of humanity and how we can support other humans, those that are in greater need than we are. But I will leave the healthcare industry grateful for the compassion that I have seen over the years for fellow human beings. Yeah.
That's good. I love that. I love that. Well, thank you. I enjoyed the conversation.
Thanks, Noah. Happy to be here.
You did an awesome job, like I told you would. All right. Well, thank you for joining Let's Get Comfy podcast.
Absolutely.
Michelle Baker. Be sure to check out SimplyThick John as well on YouTube.
YouTube, TikTok, Facebook,
yes.
Instagram,
I'm
all
gonna
the
look him up
things.
too. I love that. I really do, because dysphagia is not a topic very known, but that's wonderful education to put out there to families, but even other healthcare providers.
Agree.
Like, I really do.
The dysphagia patients are in every aspect of healthcare.
Yes, it is. Every aspect. Well, thank you again.
You're welcome.
We're done.
Thanks for having me.
Yes,
Thanks.
sir. All right. All right. I know you all been waiting for this. The wait is over. 2 healthcare titans from the organization that is taking over not only the state of Florida, but about to be the U.S. as well. The Rose Program. I have with me here my man, I call him Breezy, the Director of Business Development, Dan Fabrizi. And I have, of course, CEO and founder, Dr. Dave Thimons. Round of applause for you fellas. Yes, sir. Thank you so much for joining the platform. And in Let's Get Comfy fashion, I always challenge healthcare professionals to introduce themselves. And I want you to brag and boast a little bit. We'll start with you, Dr. Thimons.
All right. First off, it's great to be here. An honor to meet you. But my name's Dave Thimons. I'm a palliative medicine physician and the CEO of the Rose Program. We founded the Rose Program about 6 years ago, and I'd love to tell you the story before the podcast ends, because it's named after my daughter. who I love, and she's my inspiration and motivation for this company and for everything we do.
Oh, man, I like that.
Yeah.
That's a good one. All right, go ahead, Dan.
So I'm Dan Fabrizi, the Regional Business Development Director for the Tampa Bay region. I've been in senior living for about 13 years. Took a little break, did some real estate for a bit, but have been blessed to rejoin the Rose program and work alongside Dr. Thimons for the same common goal of providing really good quality care across, obviously, the state of Florida. But to what you said, Norman, like, we have big goals with this program. So it's been a blessing to work with him, and we're just getting started, man. The sky's the limit for us.
Yes, sir. Factual. The sky is the limit, man.
Yeah.
So sticking with you, Dan, what's your number one professional motivation right now?
So for me, when I had the ability to join the Rose program, obviously I looked at the services that they provided and saw what it could do on a more global scale, how we can impact thousands and tens of thousands of people across the country. And that's why I got into the industry in the first place, was to really make impactful changes into people's lives. Help a lot of the building staff. I mean, I was a former owner of several buildings, and to be able to help the building staff and the residents is kind of creating two in one, and something that I've always wanted to do with my career. And now I have the opportunity to do it with a guy like Dr. Thimons. Man, it doesn't get any better than that.
Yes, sir. Breezy. So that's going to be my ad lib during the show, by the way. Dr. Thimons, sir, this question is for you, man. What are two of the most impactful decisions you've made in life?
Well, I'll share with you a couple in life and a couple in business.
Yes,
So,
sir. Okay.
as always, I'll over talk. But I would say the two most impactful decisions in my life are, number one, marrying my beautiful wife, who without her, I wouldn't have the strength to be here and to focus on everything we do in the business world, because she manages my life and she's amazing.
Ooh.
Number two,
Yeah.
having my three awesome kids. So I wish they were here with me today, because you'd have enjoyed them all.
Yes, sir.
But, impactful things when it comes to business. Okay, the Rose program, again, is founded and formed in honor of my daughter, who had a bad bone cancer when she was 12. She's a miracle survivor and she's okay, but she said palliative medicine saved her life. And, I would say since that day, it has been my mission to redefine what palliative medicine means across America and to make it available to all patients in need, because there's so many suffering families and elders out there that we want to touch them and bring some peace, comfort, and honesty, in their life.
Yes, sir. I love that. I love that, man, Dr. Thimons. So palliative care puts patients in the driver's seat. That's what the PROS program says, okay? A lot of people are not so familiar with it, and they always, you probably get this question all the time, what's the difference between palliative care and hospice care, right? Can you break that down for us, Dr. Thimons?
Love to. Great question.
Yes, sir.
Super important.
Yeah.
So in order for a patient to be eligible for hospice, a doctor has to certify that their disease, if the disease runs its expected course, life expectancy is 6 months or less, and the patient's family and goals have to be in alignment with comfort care.
Gotcha.
So again, hospice, your life expectancy is very likely less than 6 months, and you want to be kept comfortable. Palliative medicine just means you have advanced illness. So if you look at palliative medicine as a whole pie, hospice is one piece of that pie. I had a great mentor and one of my earlier bosses in my career, Andrew Lasher was his name. He said that if palliative medicine were a pill, everyone with advanced illness would be on it. Medicare says 70% of all patients in nursing homes need palliative medicine. Yet 2% get it. So our mission, and when Dan's out there pounding the pavement, our goal is to bring this service to everyone who needs it.
I love that.
Yes.
Dan, chime in on that one.
So yeah, he said it. I think the biggest thing that we face in the community is just the educational piece, right? We have a lot of conversations kind of defeating some of those misconceptions about what we do.
Yes.
And I think even more importantly, one of the things we deal with is a lot of people see us as competitors, and we're just not, right? And our ability to transcend how we provide this palliative medicine in this space should work for everybody. It should work for all specialty docs that are already in-house at these programs. So we come in and say, look, we're not here to displace, we're not here to change, we're here to work together. And it's what makes palliative unique, is the ability for us to do what we do, but work alongside the docs that are already in place and not displace any of them, because residents don't like when things get shaken up or people come and go. We want to integrate in and work with what's already in place and what's already working.
Yes, sir. So right now, we are all about community partnerships, alignments. So what are some clients or partnerships that you guys are working on right now, or some partnerships that you would like to actually develop?
So that's kind of my bread and butter, Norman. You know that, man.
Yes,
That's
sir.
one of the reasons why you and I have gotten along so well.
Yes, sir.
You know, obviously when we started, the thought process was, let's talk to the hospice companies, right? We don't want them to think that we are direct competition to them. We need to work together with them in order to provide appropriate transfers when necessary. So the hospice companies have been a big play, but from a global standpoint, management companies, ownership groups, hospitalist groups, doctors groups, we want to be talking to them because we want to make sure that their misconception of us doesn't stop us from integrating in with them. So this conference alone, we've done a really nice job of talking to a lot of different groups. And now that people are starting to understand what we do and that we're not competition, we're getting a lot of exposure. And now a lot of people want to work with us, which is exactly our intention.
Gotcha. Dr. Thimons, this question is for you, man. What is your why? I know you spoke about family, but doing this, it's like you almost pioneering it, right? But and then you have Dan out here beating the pavement, sharing the education and knowledge, right? Like, what is the why and the long-term mission overall? Because there's not even many other companies out here that has you guys kind of trajectory and what you guys are doing right now.
That's right.
Yeah, look, my why is because it's the right thing.
Yeah.
I saw what it did to my daughter when she was at the age of 12, and it saved her life, and it brings tears to my eyes. Look, we are called the Rose Program because the word palliative is often scary to patients and families. People often think it means palliative and we're giving up. Rose is my daughter's middle name, and it's a softer touch. So instead of saying, hi, I'm Dave, I'm your palliative physician. Now I say, hi, I'm Dave, I'm your physician with the Rose Program. I'm here to work collaboratively with you and your family, your physician and your team to give you an honest answer about what your prognosis is. To be quiet and listen to what's important to you. And create a care plan that is not only what's right medically, but also respects what your goals and values are. We need to let patients have choice. We need to give honesty to patients and families. All right. My other why is, look, my father passed away a year and a half ago. He had a bad liver cancer. When he was diagnosed, they said, let's send him to transfer him to a tertiary hospital for a biopsy. No one said, sir, this is what you have. What do you want? What's important to you? How do you want to live your life? And I believe that every suffering patient family in this country deserves honesty and deserves the type of palliative medicine that the Rose Program's offering.
Right. I love that because you said that perfectly. When people hear hospice, they hear palliative care, they instantly think giving up. But the Rose Program kind of puts it, first thing came to my head just then was, let's bloom together.
Yeah.
Let's bloom together. I love
that's
that.
right.
Man. Y'all can use it. I don't mind. You can use it. I don't mind.
It'll go right with our theme song.
Yes,
You know,
sir.
every rose has its thorn.
There you go.
Every rose has its
And I can
own.
tell you, I can confirm Dave loves to sing on call, so that will go
Okay,
perfectly.
let's do it, Dave.
That's right.
We'll do a song to end it out.
At the end, after we cut
Yes,
off.
sir.
That's right.
All right, so I want to do a trending topic right in today's world right now. It's regarding telehealth. Right, telehealth exploded during COVID, and now Congress is fighting over whether to make those flexibilities permanent. If virtual care becomes the default front door to the healthcare system, what are some advantages, if you can give me maybe two from you, Dr. Thimons, and then disadvantages you think about it as well?
When I look at the biggest need for older patients with advanced illness, it is those patients at home who often don't have families. They don't have appropriate food in the house. The home may not be safe. They're not getting the care they need. I think the number one biggest void in healthcare today, which leads to the biggest economic cost of the healthcare system, is not better caring for patients at home, which leads them into the hospital. And using the emergency room oftentimes when they don't need to. And so I think telehealth is critical. There are problems with telehealth, though. How do we create technology such that an older population is comfortable using it? That's number one. Number two is, I think there has to be some degree of payment in healthcare reform. Because right now it's not economically viable to drive physicians to patients' houses and see these patients. But I'll tell you, at the Rose Program, we are working and scratching and trying to find ways to take care of these patients at the home every day. It's not a big part of what we do now, but it's a small part because we're trying to figure it out.
Yes.
Yeah, it's a great subject because we've actually had conversations this week with a telemedicine provider. So it's something that we're looking into. And to Dave's point, there isn't anybody that does palliative care at home because the reimbursement rates just don't make it viable. And so that's something that we need to work on, something that needs to change as we progress. one of the disadvantages of the telehealth thing that we really see in these communities is our NPs get to touch these residents, right? Get to be face to face. When you're face to face and you're having these really difficult conversations, that interaction in person is critical. But to his point, we have to be able to provide it when they're not in a post-acute facility. When they're at home and they need similar type services, telemedicine is the way to do it. So, we keep everything kind of in track. We keep things where they need to be, but we really believe in telemedicine. And we also believe that we need some people to work with us to get these reimbursement rates raised, because then we can reach more people if we're able to do that.
Yes. So let's talk about integration and partnership.
Yeah.
So when you're onboarding a facility, walk us through your process
Sure.
of how you align and integrate into a facility's culture.
Sure. So, we try to talk to the decision makers, right? We talked earlier about how we want to make the lives of the building staff also easier as well, too. Because we take a lot of the things that eat up a lot of their time. We take that off their plate by providing really good palliative care. So we want to talk to the decision makers, and we want to make sure that they're comfortable. But we also want to work with the doctors groups as well, too, because there's some anxieties about bringing us in when a primary care is in place. We make sure that we talk to them, make sure they understand, make sure we explain it out to them. Because the perfect integration aligns when everybody understands what we do and how it benefits and helps them, not only the residents and the families, but the building staff as well. That's an important piece of what we do, and I think we do a really good job of that so far.
Yes, sir. Okay. I love that. Anything you want to add to that, Dr. Tim?
I think Dan said it great.
He said it greatly. Yes, sir. So legacy, let's talk legacy.
Yeah.
And Dan, I want to ask this question to you. What do you want your legacy to be overall when it in healthcare with memory by?
Well, I love this question because you and I have talked about this at length. When we had a cigar, we talked about this.
Yes, sir.
And for me, we have a very short time in this earth, right, to make an impact. And the thing that drew me to the Rose program was obviously working with a great guy like Dr. Thimons, but I really do believe that what we do has the ability to impact tens of thousands of people, right? When we leave this earth, what are we taking with us? We're not taking anything with us, but what did we leave? And I think what we're able to leave is a lasting impact on families. It's tough. A lot of these families in Florida, they're out of state, and they're not receiving the information they need to understand the disease process. And the Rose program does a really good job of that. So to be able to, when we depart this earth, to be able to say, I did something that mattered, and that I was a part of a team that made an impact in people's lives. Ultimately, if anybody could do that, that's a good life lived. And I think Dave would agree with that as well.
Yes. The thing that I like about the Rose program, it can be integrated in different settings
For
of
sure.
healthcare as well. But it's a supportive function to the facilities, right? A lot of these facilities out there, personnel, if you're hesitant about integrating the Rose program, I always say, what's wrong with having another option,
That's right.
but also another set of hands, legs, feet, brains, clinical aspect, clinical oversight.
And we staff
for
with nurse
patient care.
and we staff with nurse practitioners too, which is extremely important to mention.
Yes, sir. Yes, sir. Any final thoughts you fellas want to share regarding Dr. Timmons? I'll ask you this. Any final message that you want to share to dispel any, disadvantages about having palliative care services?
Okay, look, I'll put it like this, and I spent a lot of time in designing this program for there to be no negatives. This is our simple pitch to a facility or community, and if you're a facility or community out there and want to talk, please reach out.
Yes, sir.
The pitch is this: there's no cost to our service. You don't have to sign a contract. If we don't add value, please fire us. We don't take work away from any physician or anyone. We don't create any work for you. So we try to create a no-brainer where it will be hard for someone to say no. And for that, for the no cost, the no contract, we're going to bring to your facility empathetic, meaningful care that will drop your readmission rates by 50%. The average patient will take 3 to 4 less medications to decrease your pharmacy costs, decrease the amount of time your nurses are spending passing pills. Your quality rankings will increase. You can market better to hospitals. And I'll stop because we're running out of time and I can talk forever. However, we try to create something where there is no cost and no reason to say no. And you can get value add. And, what is I'll close with this. To talk about a legacy. Look, the mission statement at the Rose program is to redefine what palliative medicine means across America and make it available to all patients in need. If you look at healthcare spending in America, it is on these patients with advanced illness. who are getting things done to them that are inhumane, and there are things done to them that they don't want.
That's right.
So if we bring humanity, respect, if we bring the basics that my dad taught me when I was in 3rd grade,
Yes, sir.
to healthcare, we can make meaningful impact.
Man, that was well said.
This guy is the best, man.
Yes.
He's the best leader, man.
Talking about an elevator pitch, that
Yes.
definitely was one right there.
Yep.
So I definitely want to say, if you have any misconception for palliative services, the information that these wonderful gentlemen just shared right here today should have dispelled that 100%. They saying we're putting it, they're guaranteeing on them. They say, if you don't want our services, fire us.
That's right. That's right.
But what they're asking for is offering your patients a chance, right? An opportunity to have additional care
That's right.
provided by the Rose Program.
Yep.
The Rose Program, where patients bloom. Yes, sir.
Thanks, man.
For
Really
sure.
appreciate the time.
All right. Well, thank you all for coming on the show. Enjoy the conversation.
Yes,
Wish
sir.
it was longer for sure.
Yeah.
But
Hey,
we're
we'll
gonna
do
make it happen.
a
We got
long form
future.
one coming up for
We got
sure.
future for sure. Thank you, fellas.
Thank
All
you,
right.
man. Appreciate
Let's
it.
Get Comfy Podcast, Florida Healthcare Association 2026 Conference and Trade Show. We conclude blooming with the Rose Program.
That's right.
Thank you.
Thank you, guys.
Yes, sir.
Thanks, man.
My man. Y'all killed that,
Thank you so
brother.
much,
Yes,
man.
sir.
Appreciate you.
All right, I'll get a picture you guys
Yeah.
together here.
Okay.
On each side.
Want to center seat?
FHCA Conference and Trade Show. How you feel?
I feel good, man. I'm honored to have sat down with so many healthcare experts, individuals that are really have the passion to help the senior care population. They've dedicated their careers, but also, believe in the platform. Be willing to share their expertise with the audience and help extend the brand. That mean they approve, man, and it feel good to have your approval of your counterparts, your peers, and individuals that are really making impact. So
Right.
yeah, man, I feel good.
Yeah. No, just you've told me many times. It's like, yo, you gotta see it. You gotta see it. And no, it's something special.
Yeah, man.
And I will say big ups to you,
Thank you, man.
Mr. Norman Harris himself,
Yes, sir.
the #1 edutainment station.
Entertainment, my man.
So
for sure.
there's a lot of love that came through.
Yeah, it was.
It was great to see, great experience, and can't wait for next year, man.
Man, can't wait for next year. We hope to be here once again, Florida Healthcare. Thank you so much. I know she told me I don't have to give her shout outs all the time.
Yeah, give 'em-
but
yeah,
I'm
shout 'em
going to
out.
forever do it. Thank you so much, Kristen Knapp, Jenna Early. Special shout out again to our sponsors, Evolutionary Healthcare, for allowing this Dr. Hussein Blue, the entire Health Evolutionary family. Big shout out to all of the healthcare professionals, our CNAs, nurses, physicians, nurse practitioners, everyone that plays a part, our vendors, everyone that plays a part in the continuum of care. We know Florida is a highlighted retirement state. We need more care providers, caregivers for the future, right, as well. So please encourage, if you have individuals younger that are coming up and leading a career path, this is one area you can get in where you can see and feel your impact. So thank you so much for entrusting the platform, tuning in to the Let's Get Comfy podcast. Be sure to check us out on YouTube at Comfort Measures Media. You can also check us out on Instagram and Facebook at Comfort Measures Consulting, as well as Comfort Measures Media. I am Norman Harris on LinkedIn. I would love to chat with you, collaborate with you. My organization is all about providing knowledge and resources to the community, but also connecting healthcare professionals to help create a better continuum of care. I do that through networking events. We're going to be having more healthcare related events coming in 2027. Please stay tuned. We're getting into regenerative health. We're getting into behavioral health and those sectors, creating the melting pot of healthcare at the one and only Florida's #1 healthcare and advocacy edutainment station. The Let's Get Comfy podcast, CMC, baby. Stay tuned for more.
Oh yeah, and check out if it comes to a city near you, Comfy Connections.
Comfy Connection, yeah.
Make
We
sure
take it all over every month, last Wednesday of the month. We've been to Lakeland, we've been to Orlando, we've been to St. Pete, we've been to Tampa. We're looking to continue Comfy Connections. Please come and attend. I guarantee you, this one thing I can't guarantee. You come to Comfy Connection, you're going to run into someone that you haven't seen in many, many years, or you're going to meet someone new that can lead you to your next business growth opportunity. But also another community partner. As we know, everything is built through relationships, and that's the best place to build relationships. Comfort Measures Consulting, the networking solution in the healthcare space.
There you go.
Yes, sir. Thank
My
you,
man.
You like that?
Yeah.